Okay, say ah.
Ah.
Okay. The rise of the uvula is normal.
Okay. Now you want to test the gag reflex. This tests cranial nerves 9 and 10.
All right, so Mr. Shepard, I'm going to touch your soft palate, okay?
I hate this part.
Just take just a second.
No, not a problem.
Okay, so open up. Stick your tongue out a little bit. Okay, that's it.
Have you experienced any trouble with or changes in your sense of taste?
Nope.
Okay.
Okay, so we move on to the neck, and I check for swelling, any lesions, symmetry, and for masses.
Great. Now let's test the range of motion.
Okay, can you turn your head to the right and touch your chin to your shoulder? Okay, and turn your head to the left, chin to the shoulder. Okay, back towards me. All right, now touch your right ear to your right shoulder.
Oh.
Like this. All right, and then the left. Okay, chin to the chest. Okay, into the ceiling.
Smooth and controlled.
Thanks.
Okay, now we should palpate the preauricular nodes right here in front of the ears,
Okay.
then the postauricular nodes behind the ears.
Okay. Checking for swelling, tenderness, or hardness. Does it feel okay?
Fine.
Okay. Now some of these aren't palpable, right?
That's right, lymph nodes should not be palpable. That's a normal finding.
Okay.
Okay, now what, Anna?
We move on to the trachea.
Good. Just put your finger in the sternal notch and check to see that everything is midline.
Okay.
Good. Now the thyroid gland. You can actually use your index finger and thumb to find the key landmarks.
Okay.
And again, like the lymph nodes, the thyroid gland isn't usually palpable. And just so you know, if the thyroid gland is enlarged, you would auscultate for bruits.
Okay, so I will use the bell of the stethoscope for that, right?
Yes, the same as with the carotid arteries. We place the bell directly over the artery, but before you do that, palpate the carotid arteries.
Okay, so one at a time.
Bilateral palpation may reduce cerebral blood flow.
Okay. All right, I feel both of them. Okay. So let me just take a listen here. Okay, look this way and hold your breath. Let it out. Let me check the other side. Hold your breath.
No blowing or swishing sounds.
Nope.
Okay. Now we move to arms, hands, and fingers.
Okay, Mr. Shepard, if you can stand up for me. And then I just inspect the upper extremities for overall skin coloration. Any lesions, texture, moisture, any masses. Okay. Everything looks symmetrical. No swelling or lesions.
Okay, now what?
Okay, just keep your hands straight here and then put your hands together. Right, and then straight over your head with your elbows straight.
Elbows straight.
Yes.
Okay.
Okay, now flex your elbows and put your hands behind your head. Good. Now can you bring your right elbow to your forehead? Okay, and then the left? Okay, good. Now just straighten out your arms.
Okay.
Turn your palms up.
Up.
Okay, down. Okay, good. You can sit down.
Okay. Now to palpate the brachial pulse.
Okay, let me have your arm here. Okay, and this one. And I also want to check the radial. All right, let me check this one. Okay.
Okay, and then?
Another pulse.
Mm-hmm.
I'm just trying to remember which one. Which one is it?
Ulnar.
Ulnar, right. It's on the tip of my tongue. Okay. Just feel a little bit more faint. That's normal, right?
Mm-hmm.
Okay, that's good.
Okay, now for range of motion of the wrist.
Okay, can you just hold your hands out? All right, and bend your hands up and then down. Okay, now I'm going to test for muscle strength. Okay, so what I want you to do is push against my hands. Okay.
Right.
Okay, I would rate him as a 4 or 5 with strength.
Okay, now you want to inspect the palms of the hands and palpate for temperature.
Okay, so just turn your palms over. Okay. Okay, looks good. All right, just turn them over. Okay. Nail beds are nice and pink. Okay, capillary refill is prompt. and there's no cyanosis.
Now, why don't you look at the range of motion of the fingers?
Okay, so just bring your fingers straight out. Okay, make a fist. All right, put your fingers back out again, and then make your fingers go down.
Down?
Mm-hmm.
Okay.
And then up.
Up.
Good. Keep your fingers together. And now bring your thumbs out. Okay, back. All right, good.
Excellent, Anna.
So now we're going to go on to rapid alternating movement of the hands. If you can just put your hands on your thighs like this. All right, and then turn your palms up, back down, and then slowly increase your speed doing that. Okay?
Now, what are we looking for with this, Anna?
Okay, good. Just making sure there aren't any uncontrolled movements or tremors. So now I want to test for sensation for your hands and arms, and I'm going to touch you lightly in these places, and you're going to tell me where I'm touching you. Okay?
Okay.
All right, so just close your eyes.
You're on my right hand.
Okay.
You're on my left arm. You're on my left hand. Right arm.
Okay, good. All right, so just keep your eyes closed, and I'm going to test the sensitivity and position of your fingers. So what I want you to do is just hold your hand up, keep your eyes closed, and spread your fingers out. You tell me which direction I'm moving your fingers, okay?
Okay. You moved it up. Down.
Okay.
Up. Up.
Okay, good. All right, so just relax your arms by your side here. You can open your eyes. Okay, I'm going to go to the back and untie your gown now.
Sure.
This shows us the posterior thorax. What's the first thing we do?
Well, I want to check the shape and configuration of the posterior thorax and the scapulae, and I don't see any spinal abnormalities.
Mr. Shepard, have you experienced any difficulty breathing, shortness of breath, or coughing?
No problems like that.
Okay. Anna, note his posture when breathing.
Okay.
Then you want to palpate for tenderness, masses, lesions, and sensation. Now for crepitus.
Okay. This is when air gets into the tissue, right?
Exactly. It would give a sort of crackling sensation.
Okay. So now check for fremitus.
Use the ball or ulnar aspect of your hand.
Okay. Mr. Shepard, can you say 99, please?
99.
Okay. Again?
99.
And one more time?
99.
Okay.
Now, Anna, evaluate chest expansion at levels T9 or T10.
Okay. All right. Can you take a slow, deep breath for me?
Sure. I was planning on it anyway.
Okay.
Your thumb should move about 5 to 10 centimeters apart.
Okay. Again? And one more time. Okay. All right. Good.
Now percuss for tone, starting at the apices of the scapula, moving across and down, comparing sides. Do you remember the normal percussion tone of the lungs?
Resonance, right?
Very good. Okay, Anna. Now why don't you auscultate for breath sounds and for adventitious sounds?
You mean like wheezes, sonorous or sibilant, crackles, pleural friction rub, like that?
Exactly. Be sure to use a zigzag pattern.
Okay. All right, Mr. Shepard, if you can take some slow, deep breaths with your mouth open. Okay, Mr. Shepard, your lungs sound nice and clear. Just going to move around this way to the front here and lower your gown.
Okay, we're looking at the anterior aspect of the chest. We'll examine the anterior-posterior diameter of the chest, the slope of the ribs, the color of the skin,